who are unable to make it. And we'll get started with some introductions, and I imagine people will continue to log in here as we go along. So let's see, Frederique, let's start with you, and then Jean Smith.
Hi, everyone. This is Frederique Honeycutt. I'm the policy chair for Tobacco Free Wichita Coalition and a co-lead with Mandy Barnett for the policy strategy team working group. And it's good to be here for this last meeting with you, Rick.
Well, good to have you, Jean Smith, and then Kim Richter.
Hi, I'm Jean Smith. I'm with South Central Mental Health here in Wichita, Kansas. I also work for One Care Kansas as well.
Wonderful. Kim and then Lisa.
Hey. Kim Richter from KU Med. Had a dentist appointment run a little bit late, so just joining by car for a little while. Nice to see you all.
All right, we'll enjoy the scenery with you. Lisa, and then Jeff.
Hi, Lisa Fry Bloom. I work for Kansas Department of Health and Environment, Health Promotion.
And I'm Jeff Usher, Program Officer at the Kansas Health Foundation. And I'm taking the place of some very wonderful people who are no longer with us at the foundation.
Great to have you, Jeff, with us. And of course, we can't understate how much we appreciate the foundation support for all the work, not just for this project. Dee and then Daniel.
Am I muted? No. Okay. Hi, I'm Dee Vernberg. I'm with the Lawrence Douglas County Public Health. Nice to see everyone.
Great. Daniel and then Matthew.
Yeah, Daniel Craig with Tammy Walker Cancer Center, and I was part of the Fellows Aid Initiative. So again, a huge thank you to Kansas Health Foundation for your support through all these years.
Matthew and then Malaya.
Yeah, Matthew Schrock, Tobacco Station Coordinator at KDHE. And yeah, thanks so much, Rick, for all your great leadership.
Yeah, Malaya and then Sarah.
Malia Hartvickson. I'm the Executive Director of the Kansas Healthcare Collaborative.
Good. Sarah and then Diane.
Sarah Prim with the American Lung Association and Tobacco Free Kansas Coalition.
Great. Diane and then Andy Jones.
Hi, Diane Sweeney with Reno County Health Department.
Wonderful. Andy and then Mandy.
Andy Jones with the Primary Care and Rural Health Office out of KDHE.
Wonderful. Mandy and then Alberto.
Mandy Johnson with the Kansas Healthcare Collaborative. I'm the Program Director of Quality Initiatives with KHC.
Wonderful. Well, Alberto, and then we'll go to Amy.
Oh, hey, my name is Alberto Reyes, and I'm a tobacco treatment specialist with the Mental Health Association.
Okay, and Amy, and then Sue Mernan.
Hi, I'm Amy Boulay, and I'm the CSS Director at South Central Mental Health, and I also oversee the One Care Department.
Wonderful. Well, then Sue and Susie Moore.
Good afternoon. I'm Sue Mernan. I'm with the Association of Community Mental Health Centers of Kansas.
Great. Okay, Susie, and then Chris from KDADS.
Hi, this is Susie Moore. I am one of the program consultants for the King Care over at KDHE.
Great. Chris, and then Josh.
I'm Chris Belinsky with a Special Projects Coordinator for Behavioral Health Department over at KDADS.
Great. Josh and Tristy.
Hi, everyone. My name is Josh Boehm, and I am the One Care Kansas Program Lead at Sunflower.
Wonderful. Tristy, and then Kay.
Hi, everyone. My name is Tristy Bonds. I am the Community Health Promotion Epidemiologist working with the tobacco program at KDHE.
All right. Kay Burnett.
Good afternoon. My name is Kay Burnett, and I'm with the Mental Health Association, and I work with Alberto.
Well, I'm looking, unless it's my screen tricking me, it says, we've introduced 22 people, including myself, and Zoom says we have 25. Did I miss anyone? I see Susan from South Central.
Yes, I guess come in. Thank you.
And let's just scanning the screen there. Did we miss anybody?
Michelle Reese with KDAD's opioid program manager.
Thank you, Michelle. Anyone else hanging out there in the breeze?
Did Natalia speak? Oh.
Yeah, hi, this is Natalia Machado from University of Kansas Medical Center.
And that is Nathan from where? What was your last name, Nathan? Is it Nathan or something else?
I think she said
Not sure.
Natalia.
That was Michelle. Oh, that was Natalia.
Talia, yeah.
Okay, Natalia Machado. I'm just not hearing it clearly. I see Jamie Wallen. Can you hear us, Jamie? You want to say hello?
Hi, everyone.
All right. And what do you do? Where are you at?
I'm the mental health program manager for KDADS.
Wonderful, wonderful. Anyone else that we've neglected to introduce? So I think we are all accounted for. I'll keep an eye on the screen for others who might be showing up. And we have a couple of items in the chat. Jeff has to leave at 2. Christine Chang will be joining us at 2. And then we have regrets from Matt Prokop from American Cancer Society. So let's jump right into our agenda. I received a message from Andy Brown asking for something to be added to the agenda a little bit later. So we'll get into that. And oh yeah, having trouble locating all my documents. So I don't think we can say enough really here at the outset to celebrate the work that all the grantees in the Kansas Health Foundation initiative around tobacco and behavioral health have contributed over the last 6 years. We'll have a chance for the grantees to get together in July on the 15th. And so we'll do a little bit more celebrating then, but just a very kind of hearty thank you in short form here to everyone who's been a part of this working group and contributed in various ways to our work. It's been a long haul. I think we all realize that we've made progress, but we're not where we want to be in terms of smoking rates in the behavioral health population. I hope that we are setting some mechanisms in motion to continue the work at some level so that we, at least hold out the possibility for making more progress over the next several years. So thank you again, and I can't say that enough. But I do want to kind of move through our agenda and give people a chance to speak up along the way. So don't hesitate to chime in as you need to. The minutes from April were circulated yesterday. I'll just kind of pause for a brief moment if anyone has noticed anything that is lacking or incorrect or needs to be added. Absent any comments now or later, if you happen to be perusing them still, be happy to hear from you. But absent that, we'll kind of let those stand. And then I'll go ahead to our next item on the agenda. The document that's showing up on your screen now was sent in the materials on Tuesday. This may be the last update that you get from me. I'm hoping that this will continue to have some currency in the work with the strategy teams. Everybody gets all kinds of emails and invitations to important events that relate to our subject matter, and we've been trying to keep track of these as much as possible. I think we've highlighted some things on the calendar because they present opportunities for the education strategy team to kind of look at whether or not we can identify individuals who will offer a presentation or an exhibit at some of these conferences. So I know that the education team has been looking at this. Of note is the next community of practice date on the calendar, and we will come to that if Mary's able to join us and say a word or two about what she has scheduled. What we've done here, and you've seen this before, is organize the events which we think are coming up from one year to the next and into various categories. So you have a number of behavioral health associations, and then primary care associations, public health, oral health, and other annual meetings that come up. And so these are all opportunities to get our message or different messages in front of different audiences. I've had some correspondence with the Denise, I believe, from the Public Health Association, and she's promised to be in touch with Jamie Katz and Alberto regarding their annual meeting in September to see what we might be able to offer them at that point. So any questions or comments about the calendar or things which may not be listed that we need to draw to everyone's attention? You should have this document, by the way.
Hey, Rick, I just looked up that behavioral health conference in September, and I couldn't find any current information for the September conference.
Okay.
Does anyone know?
Well, Sue is on the line, so we'll let her speak to that.
That's what I thought.
Sue Mernan, are you there?
Sorry, I was trying to unmute. So it's not on the calendar? For what?
It's on the calendar right here in front of us, but when I looked at the website listed, it didn't have any current 2022 information that I saw.
Okay, we just looked at that the other day, so I will go back and look at that again and see why it's not pulling up. Thank you for that.
Yeah, so it'd be, in my experience, it'd be right about now, and Sue might want to add another word, but it would be right about now where we might be talking to the Association of Community Mental Health Centers about ideas for a workshop, a presentation. And Sue, do you have a sense for what the time frame would be for getting information to you?
I know Heather Richardson is collecting that information already, so I'm going to drop her email in the chat so everyone can reach out to her with their ideas.
Okay, very good. Very good. Thank you for that. Any other comments or questions about the calendar as it's been presented?
I'm just curious to see if anyone has a presentation for the opioid conference coming up.
Well, the opioid conference is November, or does anyone, it looks like it's a specific date. So that's far enough out there that we ought to be in pretty good shape in terms of talking to the folks at DECA, who I think are the organizers for that statewide event.
That's correct.
And Michelle, go ahead, Michelle.
What you have there is correct. They're now taking, what do I want to say, applications for speakers and topics that people want to submit for the agenda, which includes 5 tracks. So take a look at the link there and you'll see what all is involved.
Yes, and I recall Dee seeing a message from DECA the other day, which I'll forward to you, asking for proposals for workshops. I'm pretty sure I forwarded that to Alberto and Jamie the other day. So I'm glad people are taking a look at this and thinking about opportunities. Any other questions before we go on to the next topic? Well then, all right, let's see what we have in the chat, and then we'll move on to our agenda. So take a look at Sue's message. Heather Richardson at the Association of Community Mental Health Centers would be your point of contact there. I would note, just in terms of what is behind us, is since our last meeting of the working group, we had a presentation that Babalola Facero from KU Med and I did for the meeting of the Kansas Mental Health Coalition, trying to summarize some of this work and some of the policy objectives looking forward. And then I'll have a presentation to share a few ideas at the annual meeting of the Tobacco Free Kansas Coalition coming up on June 21. So you'll see that on the calendar. And I think, Sarah, there's still time to register for that. Is that
Absolutely. Thank you for putting that link in the document there. But yes, please register today. We're excited to have a speaker from Public Health Law Center to talk about synthetic nicotine. That's our keynote. And then we'll have other presentations on tobacco retail licensing, on the Project Echo, with vaping in schools. So it should be a worthwhile 2 hours and 45 minutes.
Wonderful. And that's a virtual meeting, and there's a small registration fee. And yes, check out that link, and still time to register for that event, which is next week. All right. Any other calendar questions or comments? And then moving to item 4 on our agenda, let's just take stock for a little bit about maybe some people who joined the call. I see Chris from KDES and Jamie from Johnson County. Would you guys offer a brief introduction?
Sure. So this is Jamie Katz, Johnson County Mental Health Center, Prevention Coordinator. What else do you want to know?
Well, we'll leave it there for now. And Chris Bush, how about you? Well, Chris is on the screen. Maybe he's not hearing us, but another one of the key KDAD staff that have joined us from time to time over the last few years. So,
Hey, Rick, I was going to say one thing. So I actually just did a wonderful presentation for the Midwest Conference on Problem Gambling and Substance Use or Substance Abuse. And I was not necessarily planning on talking about, well, I was planning on talking about the tobacco guideline for behavioral health care, but wasn't planning on talking about it as in depth as I ended up discussing. But I ended up doing most of the presentation on the guideline and how other states can replicate a group from Iowa has asked that we present about the guideline and wants to know how they could have something similar for Iowa. So thought that was pretty darn cool. Again, wasn't necessarily planning on doing that. I was talking about how tackling tobacco and how culture change is possible, but the way the presentation ended up working, I'm like, oh, based upon my learning objectives, I really needed to be talking about the guideline. So just wanted to let everybody know I on the presentation and from all over Iowa, Missouri, Nebraska, Oklahoma, and Kansas.
Well, thank you, Jamie, for kind of being ready on the spot to deliver some of our messaging, and we'll be on the lookout for inquiries from some of our neighboring states about how they might replicate some of the work. That's wonderful. Well, great. On maybe some quick updates under training. I haven't seen Mary Montgomery on the call. And so if she joins us later and wants to say a word about the community of practice on September 12th. Jeff, as far as I know, that might be the last one that they're contracted for, or is there another one in December? Yeah, you're on mute, Jeff.
Sorry, I think that's the last one.
Okay. So I don't think from my correspondence with Mary that they've selected a topic or a speaker yet, unless you know otherwise, Jeff.
I was just going to try to look and see if I have any update from her. I think I saw something just recently.
Well, pop it in the chat if you do see something.
Okay.
In any case, you have Mary's contact information there on the calendar. If you're not already on the invite list for past events for the community of practice and want to get on that list, I think Mary would be happy to accommodate you. And so Kim, maybe a couple of words from you as well about items 4. Well, it's listed as 4. There's 2 4As, but about the peer specialist training module. And we've already sent out the invitation for the tobacco treatment specialist training, but you might want to say another word about that as well. And Kim Richter, are you there? She is driving, and maybe she's having, or maybe she dropped off even while she's walking to the office. So we'll come back to Kim, but if you would have seen in last week's email, if you didn't get that, let me know. We'll be sending it to a broader list here in a couple of days. But there is a fall training, I believe they're calling it, for tobacco treatment specialists. And registration information went out in that message on the 8th of June. And so we'll keep an eye out for Kim jumping back in, because we want to see where they're at with the online module for peer specialists.
Hey, sorry, I'm back in.
Okay, glad to see you.
Yeah.
So yeah, we were going to speak to your TTS as well as your peer module, if you would.
Yeah. Yeah, sorry, I had to switch from my phone to the computer. So the TTS is, we have already opened up enrollment for the next round of training. I wish I had the dates. I should have them. I think the enrollment ends at the end of June, and we already have 13 people enrolled, and we're probably going to enroll about 35. We did last time. It was kind of a busy training, but it worked out fine. I will find the exact dates for when enrollment deadline is, and when the online. Oh, there you go. You got it. Thank you. And you can see some trainees up in the picture there. Natalia is there, a number of other folks. So it's open, and you can go to kumc.edu/TTS and enroll. And also, if you have any questions, ask questions of our administrator, who's Letty Sarmiento.
So there's the key date. June 30th is the deadline for application.
Yes, I wanted to say June 30th, but it seems like it's coming up so fast, but that is the deadline. And I would encourage people to sign up early, not wait till the deadline, because we have had to put people on wait lists. So get in early, and then the training will open up, it looks like the 1st of September, and then we have a a virtual, that is on online, but synchronous. So on one day, sort of final day where we practice skills and things like that. And that's in November. So that's going well. I'm happy to answer questions. What I'll do is I'll just forward them on to Letty probably, but if you go online, you'll see a place where you can send questions. If anybody has any questions right now, we could stop a minute and ask.
So yeah,
Anybody have
before you go to
questions
the peer module, I think Jamie Wallen is on, and Jamie, I had some correspondence with Babalola recently, and he said he did have funding in place from KDADS to help defray tuition for people who are not otherwise scholarship. Is that your understanding?
Yeah, that's my understanding. The contract's gone through and it's been sent to KU, so everything's been finalized.
So, you know, Kim and Babalola have maybe some scholarship money remaining from the foundation funding, but those who don't make the cut for that could also talk with the staff at KU about accessing the funding from KDADS, which is intended to cover tuition costs.
Exactly. Yeah, so thanks, Rick. So, you know, if you work with us, we should be able to find a way to get you covered. I'm just going to go out on a limb and say that. And if you work within the state of Kansas and treat Kansans for this round. And then also, I believe that KDHE, I don't want to speak out of turn, but I know that Babalola has been working with maybe rural health at KDHE to also get some slots funded. So if anybody, and I don't know if there's any more set than that, but if anybody on the call knows more.
Yeah, let's see if Andy Jones wants to comment on that, or anyone else from KDHE.
We have supported that in the past, and I'm not exactly sure where we are with our grant funding, what we have left or available for it, but I can check on that.
Okay.
Also, do you don't think you're gonna have any trouble filling those spots? Do you want that promoted at all in newsletters or anything?
If you could get it out, you know, before the 30th, that would be great. If it's a newsletter that goes out after the 30th, then it would just be frustrating for people. But thanks, Andy, and thanks for mentioning that, because we can get you on a mailing list for a distribution list for the next training.
Okay, sounds good. Thank you.
Great. And then also before, in the past, people have been sent to the training on CDRR funds. So chronic disease risk reduction grants have funded a number of people to come get trained as well. So that's something else to look into.
Wonderful, Kim. So if there are questions about the tobacco treatment specialist training, we could entertain those now, and then Kim's also going to update us about the peer module.
Okay, and you guys know how to reach me, and I'll get you responses quick. The certified peer specialist training, we've sort of expanded the applicable audience to other people like lay health advisors, peer health mentors. You can name some other models out there. So, you know, we built it very focused for certified peer specialists, but we thought that it would serve a broader stripe of people. And so, you know, if you know of community health workers, lay health advisors, et cetera, then they won't feel excluded by this presentation. So keep that in mind. So it's become an 8-module training. The modules are anywhere from about 10 minutes to about 18 minutes. We tried to keep them very short, and there's a little quiz that goes with each one. But it's very hands-on training from the perspective of somebody who's supposed to provide peer support, not pure treatment, but support for tobacco recovery. And so that's the approach that it takes. It does provide information about evidence-based treatment and resources for that, but it's really about how do you support somebody in their tobacco recovery, and how do you serve as a part of a team. who might include prescribers and nurses and therapists to support recovery. And so it's really done. I'm going to substitute tobacco recovery in a few places where we saw quitting and cessation just to get our nomenclature right. And then we're going to do the voice over recording, which won't take any time at all. So it should be done within a month, I would say, and available for use by people. And we haven't figured out exactly how we're going to disseminate it. We would like to be able to, we've already trained one cohort of people, and they seem to enjoy it and gave us a lot of great feedback on it. And it also features a lot of video clips from Nicole Pesafume, who is a TTS and a peer, on her take on why this is important. So we will disseminate through all channels that we can find as soon as it's up and available. And there will be some pricing involved for people, definitely people out of state. And then we need to figure out how that's going to work in state. But it's a wonderful brief program, and it's taken a long time, but it's been worth it, I think.
So Kim, whether I'm kind of on the payroll or off by the time this gets released, regardless, keep in mind that the mailing list, not just for the working group, but the larger mailing list of 700 to 800 folks will provide to you and Babalola, and so you can get it out to that list among other website postings and other marketing channels that you have.
Great. This is very unique. I have attended every other training that I've seen advertised nationally for training peers and support folks, and they are not. I think this is going to be really great and hopefully helpful. So
wonderful.
Yeah.
Questions for Kim about these products that they're rolling out?
So Kim, do we go to the regular website for KU to just watch when this will be available for peers? Is that how we should
you
just
can do
monitor
that.
that?
Yeah, and if you're on any of Rick's amazing lists, you'll probably get multiple postings.
Okay.
Yeah, absolutely. Yeah.
Thanks.
Mm-hmm.
And Kim, you might, while we're moving on to the next topic, if you can put in the chat the URL for the Tobacco Education Project.
Yeah, thanks. Will do.
And, so that way, people who are kind of curious to bookmark that can do so and keep track of when the peer module is released. Great. Any other questions for Kim? So I don't think item C there under number 4 needs a lot of attention. I think we included in yesterday's memo really what needs to be said about the handoff of navigating the reimbursement maze to Department of Health and Environment. We'll let Matthew say a word if he needs to about that, but you know, the CEUs are in place. The supplemental documents have been expanded greatly. So I think it continues to be a good resource, particularly with some of the extra documents that we've added in the last few weeks. But Matthew, anything you want to say about that?
Yeah, just keep it brief. Yeah, appreciate you and your team's efforts to have everything so organized in the transfer. So yeah, like Rick said, it's got, they've done a lot of great work in getting CEUs for multiple professions approved. So KDHE, we printed up some updated rack cards that we post on our website to reflect the CEUs available for different professionals. And, we're just, I'm going to look at opportunities to, promote that in combination with our Catch tobacco cessation help training. And, also trying to get it in some newsletters and, making our CDR grantees aware. And I think, there's a lot of great opportunity there to get more people through it. And, promote it in the regular things we're doing. So yeah, thanks for all your guys' help with that.
Well, Matthew, thank you and the agency for kind of taking the ball and running with it at this point. I'm glad to see that that training module will have a little bit more life. And is there anything else under training that we've not specifically included on the agenda that needs to be discussed, or any questions about what we've covered so far? Kim, the only question, I guess, because periodically you talk about kind of the asynchronous registration, and what's your best guess? And you might want to explain what you mean by that, but what's your best guess when all of that will become reality?
The tobacco treatment specialist training, which is a hefty course, it's got like over 36 modules that you take over a 6-week period. And then as part of this training, we really have to give people opportunity to practice those skills. And so all of the modules are online, and you can do them when you want. So they're online and they're asynchronous. You can do them whenever it suits your fancy. But the practice day, we've been doing it online since the pandemic, which is not nearly as fun as in person, but it's been convenient for people. But it has been synchronous. That is, everybody has to sign in on one day, and we practice together, and we break people out in breakout rooms by Zoom, and we practice skills. We'd like to take that synchronous day and somehow deliver the same amount of practice and feedback to individuals that can do it whenever they want. And so that's where we want that would be the fully asynchronous training. And so we have committed to running a few people through an asynchronous training this fall. So we're going to figure out how we're going to do that. We might pull a few people out who have registered or registered late and said, would you be willing to do this, where the final practice day is asynchronous. So everything's asynchronous. And so then we should be able to get a little feedback, work out the kinks, and hopefully have it available to every person who wants it in the spring. Yep. That's our goal. So we'll be doing a few people this fall.
Well, that's a lofty goal, and good luck figuring out all the details, but I think it does open up the possibility that starting in 2023, that anybody can take it anytime they want.
Anytime, yeah, and from anywhere. It'll really create a lot more flexibility.
And that probably, I'm guessing, is unique in the country in terms of the available TTS training.
I know that Kentucky has one that's it's like ours.
Yeah.
It's online, asynchronous, but then they have one thing where you have to get together, and they do seem to still run cohorts of people. So you do have to wait until they open up registration. So I think it will be unique.
Wonderful.
Yeah.
All right. Any other comments, questions, or additions to our discussion about training? And so we'll move to item 5 on our agenda, which are reports from KDHE. Susie, we'll start with you. Any updates on your end that we need to know about? And then we have one item listed on the agenda regarding where you might be with the addition of pharmacists to the guidance for counseling for tobacco cessation reimbursement.
Nothing new at this time. And then regarding the pharmacist being able to do the counseling cessation, I know the pharmacy team is still currently working on that policy.
Okay. All right. So
I will make sure I do send you out the bulletin and all that as soon as they're done.
Wonderful. And so I think you know, if you send it to me before June 30th, I'll make sure some of the right people get it. But if you think it's going to be later, then I would suggest, I think as long as Lisa and Matthew at KDHE have access to that, Susie, they'll know some of the other right people who'll need to see it, including our systems change team and our policy team, for example. Does that make sense?
Yes, it does.
Wonderful.
And then Kimber contacted me the other day regarding getting the information for the counseling codes and any of the smoking prevention medications and like that stuff. I do have it to the data team. I'm just waiting for them to get the information back to me.
Right. So this will be great as we're trying to collect data from not only CanCare, but private insurance and the state employee health plan about utilization of cessation benefits. So, and somewhere off in the future, Susie, we hope the policy team has a reminder to kind of look at dental providers and whether they could be added to your counseling guidance as well. And I think the only thing that kind of touches kind of your world, Susie, is we got some folks, particularly Dave Vernberg, who's on the call today from our data strategy team that are working on some of the OneCare Kansas data and the opportunity for some interviews with some of the OneCare Kansas providers to try to get a better idea of what's going on in that program and how we might improve some of the engagement of their clients around tobacco recovery. And are you part of that OneCare Kansas team there at KDHE?
Yes, I am.
Wonderful. And Dee, did you want to say anything more about that at this point in time?
Suzanne, I was just wondering if you had seen our proposal and if you had an update on the status of how you're thinking about this proposal and when we would get permission to do this.
I have not seen the proposal. We don't meet till Thursdays, so I'm wondering if they will be bringing it up tomorrow in our meeting.
Okay. Okay.
Do you know when they sent in the proposal?
It was about a month ago, or it seems like a month ago. Maybe it was 3 weeks ago.
Yeah, so maybe Dee, we could resend to Michelle and copy Susie. If you need Susie's contact information, I can get that to you, and that way they'll have it fresh for tomorrow's meeting.
Yeah.
Excellent. Thank you.
I can ask about. Thank you.
Great. Any questions for Susie or anything related to CanCare and healthcare finance? Well, then we have several things by way of update from the folks at the Bureau of Health Promotion. We'll start with Tristy. We've sent you the infographic that she prepared on the Kessler 6 scale. Tristy, do you want to speak to that? I can try to bring that up on the screen, but it was sent as a handout in yesterday's message as well.
Yeah, sure. Actually, I've got it, Rick.
Okay, are you going to put it on the screen then?
Yeah, I think I got it there. I don't know if all my stuff is black.
Oh, great, thank you.
Okay. Yeah. So mental health and smoking in Kansas. So this was 2020 Burpus data that was used with Kessler 6, and then we did by smoking, individuals who smoke versus individuals who don't smoke. So here is just kind of what Kessler 6 is, how we kind of decided what their psychological distress was, et cetera. On the left is a pie chart. It breaks it up. So this is among all Kansans, not just those who smoke and don't smoke. It's not broken up into that. It's all Kansans, and then their mental illness level. So the purple is no mental illness, the peach is mild to moderate, and then the yellow is substantial. On the right-hand side, that's mental illness among all and smoking status. So it shows smokers and then non-smokers. So you can see here that individuals who don't smoke or non-smokers here have a higher percentage of no mental illness when compared to those who do smoke. However, it flip-flops when you look at mild to moderate mental illness and substantial mental illness. Those who smoke have a higher percentage than those who do not. Below, these are the exact questions that are asked on the Burford scale, and it reads exactly as the surveyor asks them. So the first question starts with about how often, and then the other 5 questions start with during the past 30 days. And then in kind of bolded and purple here is kind of like which differentiates each of these questions. Further down, there is another bar chart. And so we have a percentage of individuals who feel this way all the time. So with the Kessler 6, it asks, do you feel this way all the time, some of the time, and it breaks it up into these different categories. So we wanted to look at people who smoked and didn't smoke and who felt worthless, everything's an effort, restless, hopeless, nervous, and depressed all the time. You'll see though that depressed is missing from this because the relative standard error makes that statistic unreliable. So we just used the other 5. And so here you can see the smokers versus non-smokers and those who feel each of these ways all of the time. Further down, it just shows the association with mental health disorders have an increased risk of smoking. And then unrelated to Kessler 6, but related to mental health, we look at poor mental health days. So that is a question that's asked based on the last 30 days. How many days would you say that your mental health was not good? And those who said 14 or more days, we classify that as not having good mental health or poor mental health. And so you had those people who smoked had twice as much as those who did not smoke of poor mental health days. And then just below there are the sources there. So if there are any questions at all or clarifications, I'm happy to, you can reach out to me or ask me questions now regarding this. And we're looking forward to getting more data in the future. Thank you, Rick and crew, for helping us with that to be able to provide this information.
Well, Christy, thank you for your continued good work on kind of making sense of the Burford data. I think one question I have for you, we'll see what others want to ask, but you know, if you look at the 2020 data, which is what we're looking at here, compared to earlier years, are we making any significant progress in terms of reducing the rate of smoking in the behavioral health population, or is it still pretty flat?
No, that's a good question. And I think that's something that I would have to look into greater detail. I don't have the numbers right in front of me right now to be able to know that, but that's a good point, Rick. I think that that would be beneficial if I brought up those categories and did an analysis and kind of saw trend lines and stuff. So I will add that to my list of things to do and have that and send it out to folks.
Yeah, I think the data team would be a good place to start with that. And of course, we hope the working group will have a life, you know, beginning in the fall. And then so there'll be an audience to share that with. And I see Kim's got a question, but I want to just ask you first, the 2021 Burford data, would September or later be the right time frame to be looking for an initial look at that data?
Yes, I believe so. Usually it comes out, around August, September. So it just depends on when we get that back. It will take a little bit more analysis to break it down by that time. But yeah, as soon as I get it and I'm able to analyze it, I will share it with everyone.
Yeah, so that's kind of the way it works. The 2022 survey, which is going on now, we won't see those results till the fall of next year, and the next year in which the Kessler 6 scale will be used will be 2023. So I
Okay.
hope you'll stick around for those results in the fall of 2024. That's a good ways off. But Kim, what was your question?
I guess my overall question about change between the last time the Kessler 6 was done and 2020 would be, does the proportion of smokers among people who qualify and for having emotional distress change from the first time we saw it to the last time we saw it? So that's, for me, the big question.
Yep, I will add that to look at whenever I go back and look at trends from the previous years of Kessler 6 data that we have. Thanks, Kim.
Yeah.
Yeah, we always hoping that we are moving the needle. I mean, that was the goal with the investment from the foundation and all the work that all the grantees and everyone else has done. But I guess the proof will be in the data. So any other questions for Tristy about the BRFIS data? And then Lisa and then Matthew, maybe an update if anything that needs to be said about what the work of the CDRR grantees and the quit line. Any news from you guys?
Regarding CDRR, the grant year is wrapping up for the fiscal year 22 grantees. So July 1st will start fiscal year 23, and we have made the award decisions and we've notified the applicants who are receiving awards for fiscal year 23, but we haven't published that. But when we're going to have a press release and a new map, and when we get those organized, I will definitely share it with this group.
Wonderful. Yeah, I think.
And it'll be updated on our website as well.
Wonderful. And while you're speaking, are you the person to say a word if you know anything about what's the timeline for this website contract that you might have, that you might be working on?
Well, I'm sorry to say that there's not a firm timeline right now because we still don't have a communications position hired, and I really can't start that contract without that person.
Right.
So,
but
it was supposed to be like starting this summer. I really doubt that's going to happen, but I mean, it's
but the important thing
before
is
next May.
you have the money set aside to do the work, right?
Correct.
Okay, wonderful. So it'll happen eventually, just not on the timeline that you envisioned initially.
Correct.
And then we'll hear from Matthew as well, and then see if there are questions for Bureau of Health promotion, anything new, or you want to emphasize, Matthew, with the quit line.
Yeah, with the quit line, we're getting our numbers back up. They're pretty low the last couple of years with the start of the pandemic. And that was just nationwide. I think on average it was down about 27%. But we're starting to see it since about March with the start of the CDC Tips from Former Smokers campaign getting off the ground. And then at the same time, we also increased our nicotine replacement therapy offering for all individuals. So before, we'd had, a little bit more for like if you qualified for the behavioral health program or you had Medicaid, but now, we've opened that up for everybody. So anybody enrolls at the quit line, they're going to get 4 weeks of nicotine replacement therapy, and that's going to be shipped directly to their home free of charge, so they can choose the patch, gum, or lozenge. And of course, we want them to take it longer than that. So hopefully, that'll get them going and they can, make an appointment with their provider and, take it, especially if they have, Medicaid or private insurance, take advantage of those benefits. So yeah, since we started doing that, our calls have went up dramatically. So we hope to keep that going. And, we've also done some social media campaigns. Some of our grantees have done, doing some radio, other social media. So there has been some promotion of the Quitline in the past 3 months. So hopefully we'll keep that rolling and hopefully, be able to continue to provide those additional enhancements there. And then, yeah, the other work update is, we're continuing to work with WSU CEI, and we appreciate your input, Rick, with the looking at the contract. But, we're looking towards them to help provide like some organization and, sending out the meeting agendas and kind of keeping everything organized. Where they'd be responsible for, coordinating and organizing, for these working group meetings each year to continue our momentum we have. And then also we would look at having like a monthly strategy team meeting, a smaller group of people to, keep pushing forward all the objectives we have. And so our goal is to hopefully get this started, in July, the start of this contract. So I'll keep everyone updated, but hopefully, there won't be a large interruption, in keeping these work group meetings going. And, like it's always great to see, so many people from so many different organizations on this work group, and got a lot more work to do. So I'll keep everyone abreast when we get that all finalized.
Yeah, thank you, Matthew. And so, the working group has been meeting every other month for the last couple of years. What we've talked with the folks at KDHE about is maybe a quarterly schedule would be satisfactory. So, there might be a next meeting in September, but we'll see what happens when the contract is executed in July and when the staff at WSU get their kind of feet on the ground. Matthew, I saw a note in the chat from Daniel about free NRT for all callers. Did I miss something in your comments? Is that what's in place now, or is that Daniel's wishful thinking?
No, that's what's in place now.
Great.
And how that's distributed is you get the first 2 weeks after completion of the first coaching call, and then the second coaching call, you get the rest of that 2-week dosage. And if you want to, you can switch it up. Say you did the patch the first time and maybe you want to try the gum, you can switch it up. So, and that's also kind of a little carrot there because, we just had in our evaluation results and we found that we saw our best results with individuals who did at least 3 or more counseling sessions. So that's, a little carrot there to get them through hopefully at least 2 counseling sessions.
Good.
To give them,
wonderful.
A better success rate there.
Wonderful.
I have a
Question? Go ahead, Kim. Yeah.
I have a question for Matthew. How long is this full coverage for all callers for NRT?
We don't have like an end date on it. On a lot of promotions, I've tried to make sure they put like while supplies last, just in case, we're just overwhelmed.
Okay.
Or there were to be some, and that's always the big thing. And I think we all, with the Quitline, we try to just kind of push it to the edge there each year. And it's kind of a guessing game. We work with our vendor on projections and, so you just have to see, there's times external forces, maybe, I've been kind of wondering lately, will like the inflation, cause more people to seek out, quitting smoking, there's always those factors there that might, and with the CDC tips campaign, that's going to run to about the end of September. So hopefully we'll keep our numbers up, and then sometimes it dips for a few months, but yeah, we don't have an end date. So hopefully we can just keep that going, and we're continuing to look for more sources and, we get some assistance from Medicaid, which definitely helps a lot. So yeah.
Very good. Other questions for Matthew and Lisa? And there've been some posts in the chat from Sarah and Kim with links to things that you want to take a look at. And so while the meeting is going on, you can click on those and kind of go back and look at those URLs later. And well, thank you, Matthew and Lisa. If there are no other questions for these guys, we'll look forward to staying in touch about all this work. And we'll move on to KDADS and hear from Chris and Jamie and Michelle. And Chris Belinsky, are you hearing us? And what do we need to hear from you?
Most of what you have to hear from me is what Andy added on. So we're going to be a little behind because Charlie deeply in his soul needed to go fly fishing for 2 weeks, which I understand. But when he gets back July 1st, that's kind of, at least for me, when we have a hard deadline on who we need to figure out who at least the core group of people is going to be on the subcommittee, so that Charlie and I can sit down with them, get the charter written up, and so and get everything all ready to go.
Just to put this into context, Chris, I mean, we're talking about the formation of the tobacco subcommittee. I'm guessing that in terms of the membership of that subcommittee, that you should at this point know who is going to be on it from KDHE and KDADS. I believe Babalola's name surfaced as the representative from KU Med. Sarah, I presume, for Tobacco Free Kansas Coalition, but she'll weigh in a second if I'm wrong about that. Daniel, I believe, for the Kansas Public Health Association. And then that leaves the strategy teams. I believe Chad from Systems Change, and Dee from the data team, and Alberto from the education team. I'm not sure about policy, so I just wanted to do that quick review and see if I've got it mostly right or what I might be missing here.
On policy, we have selected liaison, and it will be Sarah Pren has stepped forward and will take on that role for us.
Okay, so Sarah will represent policy, and she'll have to wear 2 hats unless, Sarah, you have someone else in mind from TFKC.
Well, I'll talk to our current policy chair for TFKC, which is Carrie Rinker.
Yeah.
And see if she might be willing to. I mean, she's chairing policy, so she actually has maybe a little bit better grasp of it. So probably the 2 of us.
Okay. So Chris, does that help in terms of update?
Yeah, I mean, I knew that there were a number of people, I guess, just out of that group who will want to be directly getting the framework of the thing that I talked about 5 seconds ago and completely forgot the name of.
The charter, you mean?
The charter. Thank you.
Yeah. So Andy's note from yesterday that that Chris is referring to is saying what we ought to try to do in the next couple of minutes be, as Chris is saying, identify 3 or 4 people who are going to be on the subcommittee to have some preliminary conversations about the charter document that will kind of set the stage for kind of launching the tobacco subcommittee. So we could ask for those volunteers now and see if we can answer Andy Brown's question. If not, then perhaps within a day or two of this call, we can figure that out. But some of the folks who are going to be on the tobacco subcommittee are in the meeting now. Chris, would you imagine this would be a virtual meeting or two to kind of figure this stuff out?
Yeah, Charlie's more, he's got plenty of experience getting the charters going. But yeah, I can't imagine it's going to be more than a couple of meetings just to get the framework done. And then once we've got that in place, the committee can work on getting it filled out to their requirements.
So the only person that we didn't mention was a representative from the Community Engagement Institute. That contract between the CEI and KDHE is pending, but I'm guessing, Matthew, that maybe the default name would be Mary Montgomery. So are there people on the call today who are going to be part of the subcommittee and who'd be willing to work with Chris or Charlie Bartlett at KDADS to help with the charter design?
Hey, Rick, this is Daniel. I'm happy to help.
Okay, very good.
I wouldn't mind helping either. I wouldn't mind helping either. Just need, a couple weeks in advance. That way I can, structure my schedule appropriately.
Okay, so we've got Alberto and Daniel. Is there a third or a fourth who want to be part of this conversation to help draft the charter document? So, Chris, what?
At least Daniel and Alberto, if you could put your emails in the chat, and then I can get working on that. It'll be preliminary because, again, Charlie is well outside of my ability to communicate with him for the next 2 weeks, but I know he wanted to get on that kind of right when he gets back.
So I see Daniel's popped up in there. Alberto will put his in there as well. I'll reach out to the others who are slated to be on the subcommittee just to see if anyone who is not here might want to join that. And I will just say, Chris, I've already provided you with my Gmail address. I would be happy to sit in on a meeting in July if I can kind of provide any transitional help here without getting in the way. And Chris, anything else from your end as we've tried to work through that question?
Nothing in particular. I've got a meeting with Andy and legal set up to finalize the contract language for screening and offering services on intake for smoking cessation.
That's encouraging. And so I think for those who haven't been in the loop on that, what we're expecting to see in KDAD's contracts, I believe not only with the mental health centers, but other contracts as well, that there will be a new requirement for screening for tobacco use and then offering evidence-based cessation treatment. And that would be for fiscal year 2023, starting in July. So the tobacco subcommittee that Chris will be a liaison to from KDADS is expected to meet quarterly once it gets up and running. and will interface well with the working group and with the strategy teams. Also from KDAD's Jamie, you and I have had some correspondence with Dee Vernberg about self-assessment data, but you want to bring everybody else up to date if you could.
So we're just waiting on about 7 more CMHCs to finish their self-assessments, and then we'll have a complete set for FY22. And I think I just sent out a email for those last 7, and I got quite a few out of office. So I think once they become in office, they'll see my email requesting them to fill out that data. And I see Sue, I see your message in there. Thank you again. I know Sue and I have been sending out emails as well. And I think having kind of a hard date, Rick, when you sent me that email, I think will give them kind of a when we need this data, having them have a hard date as well. So even though they have a hard date, that was back in, I believe, October, but I know there's been quite a few things, especially right now with contracts and quarterly reports. So I think it kind of gets lost in the shuffle. But having that hard date, I think, and telling them what the purpose of the data is will be a good reminder. So that's where we're at right now.
Great. And Natalia Machado has been in the loop on some of this as well, and she's helped us a great deal in analyzing the self-assessment data. But this will be the biggest data set we've had so far on self-assessment. So it'll be something to look forward to see where we're at with the 25 or 26 community mental health centers. Any questions for Jamie about that? Jamie, I appreciate your follow-up, and I see Sue Mernan is going to be helping you out there as well. So also KDAD's Michelle, last time you had mentioned something about another round of substance use grants that might have a bearing on tobacco. Is there an update at this point in time?
Yes, there is. We are in the process of completing our application, explaining how we're going to use the money that's been allocated to Kansas. We did not get much of an increase. We went from 8.2 million to 8.3 million. So not a lot of increase. So not a lot of new efforts are going to be made. However, tobacco cessation is still an offer to, we can choose to provide something in that area. It's not a required element, but we can choose, like we did last year, to do that. And our current SOR2 funding, which ends the end of September, we're about 4 months out, 3 months out, I guess. We still have the 3 tobacco cessation mini grants operating. One is with SAC in South Central Kansas. One is with Bert Nash in Lawrence, Kansas, and the other one's with Harper County Hospital, one of their clinics. So those folks are still working their grants, and we'll have to expend all their funds, allocated funds of $15,000 each by the end of September. So we'll keep you posted. We may do another round of RFPs for tobacco cessation programs, working with OUD, opioid use disorders, and stimulant use disorders. But we'll have to see how the money divides out to see where we're at and how much we'll have to do that. So that's kind of where we're at with that. It's here. All we got to do is provide the explanation as to how we want to use the funds, and then we'll move forward that way.
Well, thank you, Michelle. And there might be a connection back to the question that Dee was asking earlier about the opioid conference in the fall, and at least the possibility that one of these grantees would have something to present or maybe the agency might have something to present on kind of the integration of tobacco treatment with
Yeah.
Substance use treatment.
Yep. So we'll see how it all comes together, and we've certainly got the opioid conference coming up, and hope to have something going on there.
Wonderful. Appreciate your joining us. Any questions for Michelle about the work in her area? And anything else? Go ahead.
Michelle, when would we, if you do have new grants, when would we expect that announcement?
Well, we will do an RFP we probably won't hear confirmation of our what we provided to them. It's due July 18th, and we probably won't hear till sometime in August, maybe early September. So I would expect RFPs to be sometime this fall.
Okay, thanks.
Mhm.
Wonderful. Any other questions for Michelle? I see that Christine Chang has joined us, maybe in the last 15 minutes. Good to have you, Christine. If you want to say hello.
Hi, everybody, and so sorry about that. I got pulled into another call that lasted almost an hour over what it was supposed to be. So good to hear all the updates.
Yeah, and for those who don't know, Christine with the Smoking Cessation Leadership Center on the West Coast. So it's good to have you as always. Well, we'll move on to our strategy team reports. I see, Mandy, that Malaya stepped away. Do you want, should we come back to the data policy team, or do you want to offer a report in her place?
We can come back.
Okay, so let's defer the data team for now, and we'll start with the policy. And I'm not seeing Mindy, but I know Matthew has had a hand standing in for Mindy, and of course Frederic as one of the co-chairs. So Frederic, do you want to take the lead there?
Sure, I can try. So for our group, since the beginning of the year, we've focused to, in order to decrease tobacco use in Kansas, we've focused on various objectives that fall into 3 different categories. The first category is to improve the workforce and increase the workforce, so improve competency. A second category would be insurance coverage. That includes counseling, pharmacotherapy, your providers, and then also the premiums. And then the last one would be around tax and funding. So Rick just brought up our review document here with the various objectives that we have that fall into these different categories. So the first objective that you see here on the left-hand side on the policy row has to do with tobacco-free and vape-free state properties. And so we'd like to have an executive order that would be modeled after the ones in Oklahoma that were passed back in 2012 and 2013. But we're going to wait on that until after the election. So that's still kind of just a little bit ahead, a few months ahead. So we'll leave that on the back burner a bit. The second objective here that you see has to do with what Chris mentioned, which is the fact that KDAD has the option to add contract requirements for the CMHCs and other facilities to require screening for tobacco use and offer treatment, both counseling and pharmacotherapy for tobacco users, to tobacco users. And that would be, I'm getting an echo here. Oh, can you guys hear me all right?
I think we were getting some interference, but go ahead.
Okay, so and Chris mentioned that was in store for 2023 with, I believe, adopting comprehensive tobacco-free campus policies being is kind of a tiered step approach set for the following year. So on that end, and what Chris mentioned in that they were going through legal and looking at the contracts right now. Objective 3 is the following one here, which would be, and which we're monitoring. And I believe Susan mentioned that they're looking at the policy for pharmacists, but it would be to add pharmacies, and we'd like to have dental providers for counseling for tobacco dependence in the CanCare coverage. And then the following objective has to do with a state employee health plan, and we would like to expand the benefit coverage there to make a tobacco dependence treatment more continuous, because right now in the SHEP we have coverage up to three quit attempts per year, and we'd like to bring that up to 4 quit attempts to match the coverage that is in CanCare currently, which is continuous. And so eventually we'd like, if that's passed or adopted, we'd like to pursue that for all private insurance in Kansas. There are 2 more objectives. One has to do with Spark funding, and Sarah Prem can talk more about that, but we did not reach our goal for our Spark to get the Spark funding, but we're trying other avenues. So Sarah, do you want to talk a little bit about that, or is that going to be sufficient in terms of just a little summary?
Yeah, we basically didn't get included in the buckets, but there's sort of like a secondary bucket that we're trying for. So and we had asked for $1 million, and if we can figure out a way to get into the secondary bucket, we would take basically anything we could get. So still, I think they're not really going to be all done with that until the end of the summer. So we still have a small hope that we'll get some funding.
Okay, super, thanks. So, and then the last objective that we have has to do with creating a sign-on letter to advocate with the Kansas Insurance Department for changes in the tobacco rating ratio. And that's, in Kansas, we have insurers are allowed to charge up to 50% more for premiums for tobacco users. And we're trying to advocate to eliminate that charge or reduce it. So that's these are our objectives, and they fall into all of these categories that I mentioned that we set out earlier this year. So and then that's all on our end. And again, Sarah Prem will be our liaison for the tobacco subcommittee. So we're grateful to Sarah.
So yeah, thank you, Lisa, as well, for what you put in the chat that might be of interest to the policy committee. Sarah also put an item in the chat relating to our work with the insurance commissioner, an upcoming webinar that might be of interest, particularly to members of the policy team. So questions for Frederic, or anything else, Matthew, that you want to add from KDHE's perspective? So if there are no questions for the policy team, again, as Frederic mentioned, the document that you're seeing on the screen is an attempt to summarize very broadly the work of each of the teams. And so we'll now take a look at, Daniel's on the call. I don't think Chad is here, but we'll take a look at the systems change work. And Daniel, an update from you.
Sure,
Oh, wait a
and I
minute.
think Kim's trying to get in a question there, so I'll let her go.
Let's get Kim's question. Sorry about that. Yeah. Oh, did you have a question, Kim?
Sorry, I was muted. These are incredible policy priorities, and they're just focused on things that I think will have a big impact in many different ways. And it seems like this group has created incredible momentum where we're actually able to to believe that some of this stuff is going to happen. And I guess I was wondering from the policy team's perspective, Rick's, other people's, Chris maybe, you know, this initiative as an initiative is about to sunset. Are the things that are kind of, that have momentum, you know, are they gonna happen? Is there anything that we need to do to try to make sure that these things actually come to fruition? And I'm thinking in particular about the treatment mandate through KDADS and perhaps a tobacco-free policy and the setting and treatment settings. I don't know, and maybe it's too broad of a question right now, but it seems like, you know, it'd be lovely if we could tie the bow on all this stuff, you know, July 1, but we're not going to be able to do that. Is there anything that's going to prevent us from seeing this through and or that could ensure that the momentum keeps going?
Well, Kim, it's a big question and others may want to speak to it. I'll just say that some of these things on this policy list are as far out as 2024. So I think there's a reason for us to hang together for several years, if nothing else, to make sure that we are making progress on all these policy goals. But I think, you know, everything hinges on kind of how motivated we get. I mean, we're losing some resources that NAMI has provided. We're gaining some resources in other areas with increasing engagement from our state agencies and Tobacco Free Kansas Coalition. You know, I think from what Chris has said today and earlier, the contract provisions at KDADS are wired, but until they're signed, sealed, and delivered, then we need to just keep asking for updates and kind of finding out where that's going. But many of these other things are going to require persistence and monitoring and follow-up. And so anybody else want to weigh in? Kim's asking, I think, a very important question, not only for policy, but for all the other work.
So hold on. Yeah, okay. So on my end, on the contract stuff, to make you feel better, even if all of you quit today, that's
what I want to hear.
That's what I'm doing, right? So we're going to get in for sure this year. I've already confirmed with Andy that as soon as we can get the language done, all future contracts will have the screening so that we can get some good data on the actual smoking tobacco use in our populations, which we don't have enough of. And for sure, as soon as I'm not sure if it will be this year or next. I think there might have been a misunderstanding. So our plan is 3 years to get to the smoke-free campuses. So first year is full screening on everyone who comes into any of our facilities. The second year is mandating that they offer evidence-based treatment to anyone who pings yes on the screen for tobacco use, and make sure that they have the resources available to do that. And then the third one is where we'll probably need more momentum from other people to get them to accept, which is the tobacco-free campus. But the first two we're just going to do, regardless of what any of the rest of you do. We're planning on getting services increased and screening into the contracts regardless. So you don't have to worry about that. But yeah, so that's where we are.
Great.
So
great, wonderful assurance from Chris. And any other follow-up to Kim's big question?
Yeah, I mean, I feel that, you know, since we have this policy strategy team group set up and we planning to, you know, meet monthly or you know, for the foreseeable future. So I think that we can keep that up and you know, with each of these objectives, we'll have different action items that will be outlined and that we'll pursue. So and then we'll be linked to the tobacco subcommittee. So I think there's sustainability there. And then also we have an environmental scan that will maybe Rick will be bringing up later, a document that in which we could probably add these objectives. We have already a policies outlined in that that scan, but maybe we could reconcile both and have these policy objectives in the scan, and the scan is going to be managed and owned by Tobacco Free Kansas Coalition. So that'll be, you know, this is an organization that is not going away. And so I think, you know, I think there is hope there that that we can pursue this and that we'll arrive at, hopefully we'll reach these objectives.
And I would echo that. Yeah, Tobacco Free Kansas Coalition policy has always been an important part of what we do. And so we'll continue to focus on that, but also with both or all three, heart, cancer, lung, we all have representatives working in Kansas. And like you saw from our upcoming webinar, lung is very interested in increasing tobacco cessation coverage. I mean, all our organizations, those bigger organizations, are also working on this. So I feel like we're going to be okay.
Okay, good.
And so don't get any ideas from what Chris said about everybody quitting tomorrow, but he's going to do certain things, but we're going to have to do others. And all right, so this is great, and great discussion and great motivation. And Daniel will go to systems change now and get your update.
Sure. So I'll give a short update and then I'll put Chad's email so you can email any hard questions to him. Now, on a serious note, I think one of the main things that we're working on is increasing CanCare's providers, you know, their interventions, their engagement, reimbursement. And so Dee Vernberg's been kind of helping lead putting together a survey, both looking at agencies that are already doing a lot in that arena, seeing what's helping them be successful, and then looking at agencies that maybe aren't doing as much and what are the barriers or things that are preventing them from doing as much as what they'd like to do. And then there was a really good webinar, I think it was about a month ago, with the Oklahoma Hospital Association. And I don't know, Rick, if you have anything to add on that. I thought it was great, the work that association has done in Oklahoma, and I think lends itself to some exciting possibilities in Kansas. I know right now COVID's been on the front line, you know, the front of mind for hospitals, but I do think there's a lot of opportunities there.
Yeah, I had some follow-up with the Kansas Hospital Association after the webinar, and they apparently have a tobacco toolkit of some sort they're using with their member hospitals. And it seemed like they were very kind of positive about the webinar and kind of recommitting to the work around tobacco. I will, if I haven't already done this, I will forward that communication to you and Chad, because I think they've kind of cracked the door, and so we might need to kind of reconnect with them. And there's a point of contact there at the Hospital Association that is in that email. So I'll make sure you have that, Daniel.
Great. And then I think that's all I have. I don't know if Lisa or anyone else that's on the committee had some updates.
Or any questions for the systems change team. I think one of the things you'll notice is that several of the teams have some issues in common, like focus on the OneCare Kansas program. And so it's one of the reasons that, you know, we've created this grid to kind of be able to have a snapshot of what all the work looks like. And so there will be times when system change and education and data might need to be talking to each other. And that, of course, they'll be coming together in the forum of the tobacco subcommittee to be able to make sure they're not stepping on each other's toes.
I would just add that I think that survey will give great data for the policy group too, because a lot of the interventions will probably be policy related.
Yes. I did want to add a footnote, Frederic, to the policy discussion. I'm not sure if I'll be able to get this done, but my intention is to draft a sign-on letter for the item there over in, where is it now? Column H, about Kansas Insurance Department and the tobacco rating ratio. If I don't get it done, so be it, but hope to at least get a draft in your inbox before the end of the month for you and Mindy to look at.
Okay, that'll be super. And our policy team is taking July off, and so we'll meet again in August, and we could look at that. And we're trying to identify organizations to engage for this sign-on letter.
Right. All right, well, let's go to education, and then we'll hope that Malaya will be kind of back in online here for an update from the data team. But Jamie and Alberto, take it away.
Okay, so for education, again, we share a lot of the same, goals from the other subcommittees. Me and Jamie have been working on the training for the One Care Kansas. We wanted to reach out to data to see how is it that we can use some of the information that they're gathering to help supplement the training. We're also looking to see how we can provide more, tobacco cessation, information in the upcoming conferences. Let's see. Also, we're trying to compile the training resources, but with the update that we got about the website today, I think that's going to be, a little bit of a back burner kind of thing while that gets, established. So that's definitely not in a rush. Let's see. And again, just working with the other positive teams to see, how we can add some tobacco requirements to the CCBHC requirements, when they renew.
And Alberto and Jamie, anything else from education?
I think Alberto covered it.
Okay. Any questions for the education team? All right. Go ahead. Go ahead.
Okay, sorry. It was just a thought, and that is that what has happened in One Care is a little bit like what it sounds like is going to happen next year with the KDAD's contractors. That is, there's going to be sort of required screening this year, or with this contract, and then in the following years required treatment. And it seems like the lessons that we learn with the One Care rollout could inform the training and the way that KDAD's rolls out sort of the mandate to treat for their providers. So I think it just occurred to me that, it's kind of a similar process going on. So we can be learning lessons now that could be applied to that in a year or so.
No, definitely.
Go ahead.
And that's why we really wanted to work with the other policy teams, with the as me and Jamie kind of create training, and we kind of, test drive it here at MHA before we kind of spread it, to statewide. We just want to, come up with a good product, that, when those, requirements do show up, people do have the preparation so that they are able to implement those kinds of requirements.
And I'd love to be a part of it, of the training. As you're, when you develop it, if you want to bounce it off of somebody, I'd love to just help out with that.
Of course, I would definitely appreciate your input. So
Okay.
I'll keep that in mind.
Okay, please do.
So one follow up on Kim's point about One Care Kansas and KDAD's is this, that when you look at the list of One Care Kansas providers, 80% or better are community mental health centers. So you've got Chris's discussion earlier about the staged requirements that will be applied to KDAD's contracts, including community mental health centers. And so there's really only a handful of providers of One Care Kansas program who are not community mental health centers. So I think it will be important to reach them as well, but we all will have a strong base with the 80% of the providers that are already in having more stringent requirements imposed. Okay, I'm not sure. I haven't looked at the participants here. Mandy, do you know if Malaya is back?
I don't think she is. I
Okay.
can try to give an update. I've only attended 2 meetings, so Dee and Kim, feel free to jump in because I don't really, I'm still getting my feet under me, if you will. So kind of a summary from our last meeting was that Jamie was still working on the fiscal year 21 data, and that Dee has requested the tobacco data from Burfus. She did mention that there's likely that some of the years will be combined on that report since it hasn't been done since the last one was in 2017. They are going to try to incorporate the Kessler data on that report, but in counties where there's not a large enough population, it may be more of a sample size for that.
And
then-
Mandy, just a little update on that too. Tristy's been working on this and helping me. And I don't see Tristy right now. I think she may still be on this call. If she's not, then I just want to say thank you to Tristy. She's been awesome and been such a help. And they did look at the Kessler 6 for Douglas County, and there was not enough information from 1 year, so they will be combining it with several years. So that is in the process, and so they're actively working on this. And as part of this, I think what might be useful for the policy or system change, perhaps groups, is to just know that this data, these analyses that they're doing for Douglas County will, we're doing it for our health assessment, and that other counties, especially larger counties, will be able to benefit from this. So it's something that's just more than just Douglas County. I think it's at least for any counties that have a large enough population. So kudos to KDHE.
Thank you.
Thank you, Dee. And Mandy, other comments that you want to make?
And I think we had talked at our last meeting also about the subcommittee, and Kimber and Dee had both tentatively said that they would serve on that if we didn't have anyone else volunteer. And then we worked on scheduling out our meetings for July.
So I think for the data team and the other teams that are naming their representatives to the subcommittee, we want to make sure that Chris Belinsky has those names and contact information. Chris, are you missing any particular names? I see where you asked for Alberto and Daniel's emails in the chat earlier. Who else do you need? Because I just heard Mandy say that Dee and Kim could serve from data, and Chad Childs you might need from systems change.
Yeah, if you want to throw those in the chat.
So I can get you Chad's contact information, and Sarah is going to represent policy. And Sarah, if you're still there, maybe you could put your email address in the chat for Chris.
Okay.
Rick, I have a question for you or Chris on the subcommittee. Alberto mentioned, we'd like to, we all are working together, and when we met, we also have a separate group, which is just composed of all the different leads from these groups, from policy, systems, change, education, and data. And we were talking about whether or not we would continue those meetings. We have one that will be scheduled just to discuss that, but I was wondering whether are talking about, all the different objectives that we have among, across groups, with whether that would be something that would be done in subcommittee, or whether that's another that would serve as a purpose.
I think it's a great question, and along the way, as we've been trying to kind of devise the architecture here, there's been a concern about having people be in too many groups and have to attend too many meetings. And so the idea that we threw out the other day on Frederick's question is, rather than have the chairs of the strategy teams meet, have a separate meeting, that they ought to be able to come together in the forum of the subcommittee to take care of that coordination role. But I think there's a little bit of, it remains to be seen until we actually get the subcommittee up and running. I think that's the best answer I can give, Frederick.
Okay, thank you.
There was one item from education, Alberto and Jamie, that I wanted to kind of redirect on here in column I about the community medication support program. But that hinges on getting the final kind of poop sheet from KDADS on the rollout of those regulations. And Chris, do you know any more about where that stands? It was, still kind of hung up in the regulatory process. It's kind of the idea I got from the last time I met with you and Andy Brown.
Yeah, it should be done soon. Here in the next couple of days, I'm expecting the policy on policies.
Yeah. Well, so I think this will be of interest to a number of the teams, but if the education team is going to help with some promotion, then Alberto and Jamie will have to have access to that information. But I imagine others will be interested in that as well. And so any other questions for education? Data, I think we just heard from. I had one question for the data team on this item in column D. Is there a next step that the team has talked about in terms of how to get this provider level data? Is that something that could possibly move in the next few months?
I think that's the one that KU Med has been trying to get for a while.
Yep.
And we're getting Ed Ellerbeck has been spearheading trying to get that data for KU Med. But then folks at KU Med like me, Babalola, Natalia would be able to analyze the tobacco portion of that.
Yep.
For this group. And I don't think Ed has worked on it for a while. Things have been busy in the department, et cetera. So I don't know about the potential to move that.
Okay. Well, it's on the radar, and
yeah,
just wanted to kind of get that in front of everybody for a quick second. And hopefully there'll be a window opening on that sometime in the next few months.
Yeah, the the advantage of getting that would be that we would be able to, find out providers that are doing really well, find out providers who are not doing so well to provide training and support, et cetera. But yeah, so that's why I think it's a good goal. But yeah.
So here we are, 10 minutes to the top of the hour. The other item on the agenda has mostly been covered in the memo that I sent yesterday. We talked about the sustainability of the working group, and it looks like there's a very likely outcome there, a contract with Community Engagement Institute to continue to facilitate these meetings, but also to provide the kind of support to the strategy teams in terms of scheduling meetings and keeping track of notes, that the support that we had from the National Council through June. So that's very encouraging in terms of just keeping these forums alive and coordinated, and prompting people to complete their assignments and such. I think that's a critical role, and I think speaks to Kim's earlier big question about, how do we keep all this going? And I think the Community Engagement Institute contract will be a big part of that. The memo from yesterday also indicated that we've updated the implementation toolkit, and that has been posted to our website now, and hoping that KDHE and KDADS will be able to follow suit. So the online version now is substantially improved over the hard copies, and so that work is now complete. Hope to hear from Bob Alola at KU Med in the next week or so about what the legal department there is saying about taking on the provider directory. Frederic and I will schedule at some point a debriefing session with Bob Alola and any other staff he wants to bring in to make sure that they understand kind of how it's put together and what's necessary in terms of updating and maintaining that. And some of that might not happen until after July 1, or maybe into August, since Frederic is going to be away next month. So I will join that conversation to make sure we don't kind of lose anything in the process. So the provider directory, again, is on our website, and hopefully will be expanded with some updates later this year. Frederic mentioned the environmental scan that is now in process with the Tobacco-Free Kansas Coalition, and the latest version of that will be posted to their website. Sarah, I'm not sure what timeline you have in mind, but you want to speak to that?
We are building out a new page for it, so it's going to be a little, at least a couple weeks, at least more.
But again, these are all projects that will have a life beyond June 30th, and certainly we're grateful to all the partners who are stepping up to take pieces of this and keep them moving forward. We've already mentioned the Navigating the Reimbursement Maze, which now has a new life at KDHE, and so I think sustainability wise, we've updated the sustainability plan. So if you want to look at the details of that, that link was provided in yesterday's memo. I do see that we have item 9 on the agenda, but I don't really have a substantive report, just to say that the Justice Involved Collaboration Group has met once. There's a good array of people there. We have another meeting scheduled possibly this month or next. I don't have that date in front of me, but this is kind of a spin-off group within the a list of things that the systems change group is interested in, but the discussion group on justice involved population is meeting separately. And if there are folks in the room who want to be a part of that, please send me a note. I'm planning on being involved with that beyond June. And Brittany Brest from NAMI, Kansas, and Elizabeth Abla from KU Med in Wichita are helping to lead the charge on that. So with that and 5 minutes to go, I'm going to quit talking and let's see if there's any final words from folks on the call today. I appreciate the thoughts here in the chat, and no, it's
Everybody, you can just add your thoughts. Thank you, Rick, and the more specific you can get, the better. Like the way you pronounce wonderful.
If I just say thank you, Rick, he can fill in whatever he wants.
That's right. That's right. Yeah. Oh my gosh, what a ride, huh?
It has been a journey. And I think we know that the work is much work remains to be done. And that's why we have this structure in place to make sure that we will continue to work toward these goals. Anything else before we close out for the afternoon?
Well, we got it. Go ahead, Alberto. Sorry, go ahead.
Just like everybody's been saying, I just wanted to thank you, Rick, for all the work that you do. I mean, I personally really appreciate everything that you've done in the last couple of years.
You bet. It's been pure pleasure, sometimes aggravating, but mostly pleasure. And but it's time for me to step aside. Well, we wish you a great balance of the afternoon. Some of you have received my personal contact information. So I think the strategy team leads and those who will be serving on the tobacco subcommittee all know how to get a hold of me. So things are not going to fall through the cracks. I'm planning to put some files and folders in the, what do we call it? Where are we loading the files, Frederic, for the strategy teams?
The drive, the OneDrive.
Yeah, wherever that is, I'm going to stick.
The shared drive, the SharePoint drive.
Thank you, Christine.
So all of these projects, as we've mentioned, I've got stuff socked away here and there, and I'm going to try to organize it a bit and make sure it's accessible to folks who are going to carry things forward. And wonderful. Final word here. It is 2:58. Maybe we can give you a minute back of your day. It's been wonderful to have you. It's been wonderful to work with you. And I look forward to kind of hearing about the great work that goes on for the next several years. Godspeed, everyone.
So Rick, when's the retirement celebration?
Oh, nah, retirement's the wrong word. It's just a transition to another phase of life here, but it begins on July 1. I'll see some of you in Wichita on the 15th of July, and for everyone else, thank you again and appreciate your being with us today. And we'll stop the recording and let you go.
Thanks, Rick.
Adios.
Thanks so much.
Bye.
Be
Thank
well.
you, Rick.
Bye-bye.
Bye-bye.